Okay, we're going to get started. Good morning, everybody. Welcome this to the 50th reunion guests and alumni. Welcome back to the School of Medicine and Dentistry. Some of you have been here many times. I think a few haven't been back in 50 years. So you've been here now. I think most of you got here yesterday. We had that great dinner last night, the Dean Circle dinner. Gave out the alumni awards. It was a really special night. When I look back at the history and legacy of the School of Medicine and Dentistry and how many leaders came out of this place. And the other thing that I've really learned in the current role is that when I talk to alumni, there's this kind of specialness to this place that I've been at a lot of places and I haven't seen that so much. And it really struck me at Cy Schwartz's funeral when we had a memorial service for Cy Schwartz. We actually had to do it like a year after he died because it was during the COVID epidemic. But so many people came back from all over the country and all over the world. And it was really special for me to see that because these bonds are really unbelievable. And a lot of people hadn't seen each other in 20 or 25 years, and they just got together, and it was the old stories and the laughs and so many people came up to me and said that this place changed their life and changed the trajectory of their career. And I just heard all these great stories about the richness of the environment here. And so you're here 50 years later. Have you noticed any changes? I barely do. Things change fast, and it's funny because we talk about the new tower, and the new tower was the one that was built in 1970. So that's not the new tower anymore. If you driving in, I hope you saw the 20-story crane out there as we build this new facility here, which is really overdue. I mean, I guess I could say we are blessed with a relentless demand for our services. Probably one too many hospitals closed in Rochester. And if you go to our emergency room and see the 70 patients in stretchers that we don't even have beds for in our emergency room, you'll understand that. And so that new facility is so needed, and we're delighted that the cranes are there, and we're going to start to see steel go up, and we'll be able to modernize the facility. We're going to triple the size of the emergency room, which is what we actually need to deal with the volume that we have there now. And then the idea is to, over phases, build that out, build patient rooms, build more operating rooms, procedure rooms, and ideally have every room here be a private room. The hope is that we'll be able to expand to meet the demand. And it's really interesting because I was talking to Kathy Parinello, who had been the chief operating officer of Strong for many years, most recently as the president and CEO of both Strong and Highland. And she's been here for almost 40 years, I think. And she's a remarkable person. And one of the things that she has is this kind of institutional knowledge of everything that's happened here in all the buildings. She started here as a nurse, a surgical med surg nurse, actually a surgical nurse on the surgical floor, and is now the CEO of the hospitals, both hospitals. And so just looking at how we're going to be able to meet the demand. And Kathy tells me that probably 10 years ago, there was a lot of high-priced consultants that came through here and said, you've really, really got to shut down. You're not going to need inpatient beds. You need to shrink the hospital, get rid of half of the beds. And thank God nobody listened to those high-priced consultants, because Strong is licensed for 886 beds, I think, and pretty much every morning we're close to 1,100 patients. So we've been dealing with that just in terms of the increasing demands for our services, which is, it kind of makes sense because the region actually is kind of growing a little bit in population, not a lot, but the biggest risk factor for needing hospitalization is age, and with the demographics of the baby boom, we're just going to see that continue for the next 20 years, increase in demand. So we're ready for it, and we're very, very excited about the new facility. But that's not what we're here to talk about this morning. We're here to honor all of you for your 50th reunion, and welcome to this medallion ceremony. This is a uniquely Rochester tradition that I haven't seen at other places, and I think it's a wonderful tradition. We're really glad to welcome you back for this milestone. And I wanted to take a second to just thank your class for your generosity over the years. In this year of the 50th reunion, you raised $1.1 million for the institution, and I'm very grateful for that. So I wanted to personally thank you for that. And I'd like to start by inviting the class of 1974 reunion committee member, Dr. Phil Greenland, up to the podium to receive his medal.
Well, thanks, Dr. Lenahan, and really so pleased to see everybody here, and so glad I didn't trip on the way up. And so glad that I have this opportunity to wear this Rochester tie again for I think the third time coming back here. So it's really nice to see so many of the class here and get a chance over the last few months to reach out to so many of the class and reconnect. And this morning at breakfast was just great. So anyway, I hope we all have a great weekend and terrific to see everybody. So my job is to read the names of people who are getting the medallions here today. And I'll start with Claire Anderson.
And your job is to come up and receive your medallion. I forgot to mention it. If I had a guess, I would have said this.
Alan Aquilina. I could see Alan already knew that he was next, so. John Brewer. David Kahn. Is Ted Hirakawa here? No.
That's
Okay.
not here? I'll give it. He lives here.
Bob Hogan is here. Charlie Mangano. John Morris. Gene Olson.
Yes, you are.
Sig Peterson. and Scholl. Barney Stern. Barney Stern. Don't get nervous. These are not in alphabetical order, so everybody gets a medallion. Don't worry.
They're in order of MCAT scores, right?
Charlie Tucker. Charlie Tucker. Jack Vanek. Todd Light. Pete Kogut. Pete here. All the locals are not here. Alex Gertzma. Kathy Lloyd here? No. Dave Kurish. Bob Cusworth. Steve Ching? No. Dave Dillon? All these delinquent registrants. Ted McDonald? Okay, the next one is here. Jeff Murray. John Sartini? No. John Skillings? No. Tom Spitzer? Okay, we have a lot of medals left over here. So has everybody gotten a medal? No. Steve, I skipped over you. How'd I do that? Steve Schoenfeld. So this really was a cognitive function test for me, wasn't it? And unfortunately, we have a number of our classmates who have passed on. And I think there's supposed to be a slide. So just take a moment to recall our departed classmates. So glad to see those of you who are here, and look forward to the rest of the day.
So thank you, everybody, for being here. I really do love this tradition, and it's the first year I've got to do this. So I'm not sure if you know, but I recently just took over as the Dean CEO in February of this year. So it's been 7 or 8 months on the job. So the honeymoon's definitely over. But one of the fun parts of the job is getting to do things like this. And it makes me think. I was the chair of surgery here for 10 years. And one of the things that I always say as we're sending the residents off after training with us for usually 5 to 7 years, one of the things that I always say to them at the graduation dinner as they're departing out into the world to take to the world everything they learned in Rochester is that, we've taught you to be competent physicians and surgeons, but actually the biggest gift that I've given you is these lifelong relationships with your colleagues and peers. And so, I really encourage them to cherish that and to work at that and to maintain those relationships. And so that's what reunion is about, and coming back and seeing each other. For me, that has really helped me a lot in my career with keeping up relationships with people that I trained with, because now we all have kind of similar jobs and we use each other and we bounce ideas off each other. So those relationships are so important, and that's really the spirit of the reunion. So thank you for making the effort to come back. We celebrate you 50 years later. I'm sure you're sitting there thinking, man, time flies, because it probably doesn't feel like 50 years ago that you were here as a student. But welcome back home, and we're delighted you're here. Thanks.